Fever pathophysiology causes and management. Fever is a common clinical presentation characterized by an elevated body temperature, often due to infection or inflammation. It involves complex physiological mechanisms and requires careful evaluation for underlying causes and appropriate management. Overview. Fever is a clinical syndrome defined by an elevated body temperature, greater than or equal to 38 degrees Celsius or 100.4 degrees Fahrenheit, due to an increase in pyrogens, which are substances that induce a rise in body temperature. It is a protective response to infection or inflammation, but can also be a sign of systemic disease. Fever is a key symptom in many clinical scenarios and is often associated with the body's immune response to pathogens or other insults. Pathophysiology/mechanism of action. Fever occurs when the body's thermoregulatory mechanisms are overwhelmed by the presence of pyrogens. Pyrogens can be endogenous, e.g., cytokines like interleukin-1, IL-1, interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha, or exogenous, e.g., bacterial or viral toxins. The primary mechanism involves the hypothalamus, which acts as the body's thermostat. When pyrogens are introduced, they disrupt the normal set point of the hypothalamus, leading to a fever. The process begins with the activation of the immune system, which releases pyrogens. These pyrogens then act on the hypothalamus, causing it to reset its temperature regulation to a higher set point. This results in increased heat production and decreased heat loss, leading to a rise in core body temperature. The body also increases metabolic rate and shivering to generate heat, which further contributes to the fever. Clinical features/indications. Fever is a common symptom in many diseases, including infections, autoimmune disorders, and inflammatory conditions. It is often accompanied by other symptoms such as chills, sweating, muscle aches, and fatigue. The duration and severity of fever can vary depending on the underlying cause. Common indications for fever include key points, infections, e.g., bacterial, viral, fungal. Autoimmune diseases, e.g., rheumatoid arthritis, systemic lupus erythematosus. Inflammatory conditions, e.g., reactive arthritis, vasculitis. Neoplastic diseases, e.g., leukemia, lymphoma. Diagnosis/monitoring. Diagnosing the cause of fever requires a thorough history and physical examination, followed by appropriate laboratory and imaging studies. Key diagnostic criteria include: monitoring fever involves assessing the patient's temperature, vital signs, and overall clinical status. It is important to differentiate between physiological fever, e.g., from exercise or environmental factors, and pathologic fever, e.g., from infection or inflammation. Continuous monitoring is recommended, especially in patients with persistent or severe fever. Key points: duration and severity of fever. Associated symptoms. Presence of other systemic signs, e.g., rash, joint pain, weight loss. Laboratory findings, e.g., white blood cell count, CRP, ESR, blood cultures. Treatment/management. The management of fever depends on the underlying cause and the patient's clinical status. General principles include: in cases of suspected infection, antimicrobial therapy may be necessary. For inflammatory conditions, anti-inflammatory agents and immunosuppressants may be used. In severe cases, such as those involving sepsis or systemic inflammatory response syndrome, SIRS, intensive care monitoring and supportive care are required. Key points: monitoring temperature and vital signs. Ensuring adequate hydration. Providing appropriate analgesia and antipyretics, e.g., acetaminophen, ibuprofen. Addressing the underlying cause, e.g., treating infection, managing inflammation. Key clinical points. Fever is a dynamic and complex physiological process that requires careful assessment and management. Understanding its pathophysiology, clinical features, and management strategies is essential for providing optimal care to patients presenting with fever. Key points: fever is a common and important symptom in many clinical settings. It is a result of the body's immune response to pathogens or inflammation. Proper evaluation and management are essential to identify and treat the underlying cause. Monitoring and supportive care are critical in managing fever, especially in patients with persistent or severe symptoms. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.